I think the real end game and the real goal is universal health coverage. Siloed efforts are necessary. It is how much of my career has been framed in an HIV or TB silo. That was critical to have the right discussion about met, unmet need, and prioritization of that unmet need, and then how do we take these divergent allocation resources from donors to domestic and converge them in evidence-based, stood-up responses. And then a surveillance system that is strong enough to reflect outcomes. So that delivery system that's made decisions to put their resources in this continuum of care and services are continually validated or show that it is not having the outcomes and impact we have on the populations we're after, and shift not in 5 years, but shift in that next budget cycle. That kind of self-correcting focus on what priorities to match your allocations, to have your evidence and your investments aligned, is the lessons that we've learned with the HIV expansion of services to settings that were resource poor. And that lesson needs to be remembered and applied as we look at the needs of those same HIV infected patients in their greater or in their total healthcare need. To silo just their HIV needs becomes irrational and unethical. And the pivot needs to be being clear about what the needs of your population are, what's killing them, what's increasing the morbidity, and go backward into what evidence-based counter interventions do we have that we should implement. And then how does that relate to their greater health and community health and all of that? We need to sprint to universal health coverage. It is the only goal we should be really talking about at this stage in the game, because we're not going to fix the siloed diseases without a comprehensive healthcare delivery system around it. So people who are disease specific need to, I would have to say, mature into an understanding that the needs of that population you've been so focused on admirably, necessarily, now has a different need if you're going to successfully deliver them to, achieve their full potential and not suffer from diseases that we have the science to drop morbidity and mortality for already.